Good afternoon. Welcome to the department's weekly update. Remember, we didn't have one last week because of the Thanksgiving holiday, and so this is a 2-week break. A lot to report. All right, so we almost have 65 million cases in the world and 1.5 million deaths. We have 14 million cases in the United States. Oops, I apologize. 14 million cases in the United States and 275,000 deaths. So we are in a surge. We talked about this before Thanksgiving. California now has 1.225 million cases, 1,225,000 cases, and 19,211 deaths. Of note, our positivity rate is 7.7%. That's a 40% increase since we last met 2 weeks ago, and we're just steadily rising right now. In Fresno, we're up to 39,324 cases and 488 deaths. About 25 deaths have been added since we last reported, and 4,500 cases. In terms of hospitalization, and this is the big focus right now, I'll talk about that in a minute, we have blown past our highest hospitalization. So way back in, towards the end of July, we hit 313 hospitalized individuals. We're now at 338 as of yesterday. We have 62 individuals in the ICU, and that is pretty close to our highest in the ICU. And right now we have 10 available beds. So, and you can see on here on the right-hand side, we've almost doubled in the 2 weeks since I reported last, and we had a little less than doubled in the 2 weeks prior to that. We all need to get down on our hands and knees and pray that we don't double again, because we simply do not have the capacity, and I'm going to talk about that. We are heavily into the purple tier. Last time I reported out, we were not quite in the purple tier for positivity rate. We're there now. They haven't really focused on this for the last few days because they're focused on the new stay-at-home order that I'll talk about in a minute. And so you can see here, this is a little delayed. This shows through the beginning of November, but you can see that we started this trend right after Halloween, and we started up and we've steadily went up. I want you to also note on this that we hit a couple of peaks in late June, and then it continued into late July, and the death toll really didn't hit us until a couple of months after that. In late August, the highest number of deaths occurred. And so with this recent surge, we should expect to see our death rate go up significantly over the next month or two. So today, the governor announced a new stay-at-home order with new criteria. So recall that we've kind of evolved over COVID in terms of what were the criteria for more restrictions. We went to the colored tier system. Now there's new stay-at-home order criteria. And basically what they're looking at is ICU capacity. So the state has been divided into regions. Fresno is in the San Joaquin region. That includes the counties of Fresno, Madera, Merced, San Joaquin, Stanislaus, Calaveras, Tuolumne, Mariposa, Kings, Tulare, Kern, and San Benito. Each region collectively has to maintain at least 15% ICU capacity. That means 15% of the available beds are open at any given time. The reason the focus is here is that's what will push hospitals over the edge. I heard on a call yesterday that there was at least 1 or 2 patients in hospital emergency departments locally in the emergency department waiting for an ICU bed that did not exist, was not available. That is the worst case scenario, where someone needs an ICU bed and there simply are not beds available. Typically what we kind of learned through this course of COVID and I think I've talked about this in the past, I'll mention it a little bit again. You'll recall fairly early on an alternative site was created, so an alternative care site. And that alternative care site was at the new convention center. And a whole bunch of cots were set up and some quote unquote hospital beds, basically gurneys behind screens and such. And that was prepared so that if hospitals had too many patients, they could overflow into the alternative care site. It very quickly became clear when the hospitals had the prior surge that that was a difficult proposition for hospitals to make. If someone could go to that level of care and setting, where you had a big open room with a bunch of cots in there, then they likely could go home. And so during the last surge, another alternative care site for the region was created at the old Porterville State Hospital. And it was a little higher level, and even over the course of it being open, they changed the criteria. So chances are good that they're not going to create an alternative care site at the convention center again, but they're hoping to create one at Porterville. The other thing that hospitals do is it's easier for them to manage the patients in their own four walls or within their own campus. And so they can take places like post-surgical units and turn them into ICU beds. They can take other settings like conference rooms and such and create medical surgical beds or more general beds. And so hospitals tend to want to expand capacity within their four walls than just send patients out to a place like the convention center. So hospitals are in the midst of doing that right now, looking at where they can expand capacity. A big challenge that hospitals have right now, though, is staffing. And it's a twofold challenge. One is that there are quite a few hospital staff throughout the region who are out of work right now, either because they're on a leave or they've either have COVID or have been exposed to COVID. So that reduces the staffing available to staff the available beds. And then as you increase the number of available beds beyond what you typically staff, then you need to get additional staff to staff those beds. Well, when your staffing supply is down and now you have additional beds, you need additional staff. A lot of the resources that were available during the last surge are not available right now, and that is traveling nurses. Because we have a surge going on across the United States, the supply of flexible staffing is spread a lot thinner and not as available. And then also some of the governmental resources like the Department of Defense teams are also spread thin. So this is something that's really concerning, being able to not just create the beds, but also staff them, whether it's within a hospital's four walls or at an alternative care site. You still have to staff those beds. And so a lot of work is going on right now to determine where capacity can be created and how it can be staffed. And so that's why the focus is on that ICU capacity. It's kind of a, if you will, a canary in the coal mine of the healthcare system's ability to withstand this surge is ICU capacity. So right now, our region is at 19% ICU capacity, and Fresno only has 5.8% capacity. So we're well below the 15%, but because the rest of the region has some beds still available, overall we're at 19%. But we should expect to go below 19% in the next few days with this recent increase. We were at 305 2 days ago, then we went to 291, and then we went to 338. So we are in a crisis situation. What does this mean for our staff? Staff working from home will stay at home, and staff coming to work may be asked to work from home. So you should be working with your supervisor if you're coming into work every day and trying to determine whether or not we're going to keep you at work. As much as possible, we're going to continue to see our own clients in person where we need to do that. We've prioritized personal protective equipment and such and have good protocols in place. And so we feel that that's a safe environment, but we're not pushing to add any capacity there. We're just trying to maintain right now to hopefully get through this surge. The good news that's still on the horizon is a vaccine. We now have, as I mentioned a couple weeks ago, we have 3 vaccines in the running. We have Pfizer and Moderna. Both of those are the RNA vaccines. They're the ones that need to be stored at really cold temperatures. Pfizer a little colder than Moderna. And so those 2 are the closest to approval. Pfizer, I think, is the closest by far. Moderna's close behind. The Pfizer vaccine was already approved in the United Kingdom, is expected to be approved here any day now. And then AstraZeneca's vaccine, which is with the University of Oxford in the United Kingdom, is expected to be a few weeks out. So we expect to get probably not a huge number of vaccines in the next few weeks. Remember that we still have to figure out who gets it first. Now, the CDC just announced, I think it was yesterday, that their recommendation is that the first tier in the vaccine administration would go to healthcare workers and long-term care residents. Long-term care residents are one of the most high-risk populations. That's where we've seen the largest number of deaths. And so that's the 2 focus areas that the CDC is recommending. Each state and even each county will have their own vaccine distribution plan. Right now, our county has identified that we can store at any given time 100,000 doses of the vaccine at those very, very low temperatures. But then there's also work that has to be done. How long can those vaccines survive out of those low temperatures? And this is important. So, for instance, if the low temperature storage is at Community Regional Medical Center, and the vaccine's going to be administered in Sanger, then you have to plan how long can that vaccine be out of that low temperature to get transported to Sanger. Once it gets to Sanger, what type of storage is necessary there, how long can they hold it before they have to administer the vaccine. And so it's a real logistical challenge to figure out how many doses, where they will be administered at, and what the storage and transport implications are. A lot of great minds are already well down the path of working towards those, but that's the kind of work that has to go into this plan for the vaccine distribution. Remember also that the vaccine requires 2 doses. I believe it's 21 days apart. And so let's say we get 10,000 doses of the vaccine to start. We have to understand when is the next supply of vaccine going to come in. So we wouldn't necessarily give it to 10,000 people if we didn't anticipate the next supply coming in within 21 days. We might only give it to 5,000 people so that we had enough vaccine on hand to give them their second dose. To get full effect of the vaccine, you have to have both doses. So that's another logistical thing that's being looked at. Early signals are that we'll get an initial supply, not a huge supply, but then within the next few weeks after that, we would get a much larger supply. So that's the kind of thing that we have to consider as we develop that distribution plan is that storage, the transport, and then overall, how quickly will we get the second dose in so that we're not giving vaccine that we aren't going to have a second dose to give. A lot of challenges. It's again, I will tell you, some great minds are working on this. I'm so impressed with our public health department and all of the just tireless efforts of their team working toward coming up with strategies for all of this and actually writing it up in a very comprehensive plan and working with all of the partners in the community. So everyone from the hospitals to federally qualified health centers, private practice offices. The university has one of the storage areas, so Fresno State. And then a lot of our community-based organizations have become involved in administering tests and such. And some of them also do some flu vaccinations. And remember, we'll likely model this after flu vaccinations in terms of locations and times and that type of thing. So tremendous coordination having to go on to prepare for the vaccine to come. But probably the really important thing is that we have to consider that this vaccine is not going to get distributed broadly enough to create that herd immunity we've talked about for several months. Now, the more vaccines that come online, the higher the supply, the quicker we can get the vaccine out to people. The vaccine will not be mandatory, and so if we don't have a high degree of compliance with voluntarily getting the vaccine, then it'll take a lot longer to get herd immunity, and we're going to be in this significant precaution situation for longer if we have a hard time getting people to take the vaccine. Some of the vaccines do have some side effects, and you know, a lot of work has went into considering those side effects. And so there was a nice public radio presentation last week that I listened to about this, where they had some vaccine experts and scientists on, and they took questions from the public. And one of the questions was, you know, wow, usually vaccines take 10 years or more to really get out into the general public, and this one's so fast. How can we be assured that those side effects or long-term effects aren't something we should be worried about? And one of the things that the scientists mentioned that I just wanted to share with you is that thus far, with all of the vaccines that they've developed, they have never detected any sort of long-term effects during even that 10-year period. And so vaccines are remarkably safe. And despite some misinformation that has went out about prior vaccines and some of the consequences that were alleged to have occurred that was based on one flawed study, vaccines are pretty safe. And typically, even with well-established vaccines, it's really not until you're vaccinating millions of people that even the minor side effects or possibilities emerge. And so vaccines are pretty safe. And this is not a live vaccine. The RNA, what it does is it stimulates a response. And so you're not getting injected with COVID. And so you know, we really want to reassure people that while you might feel a little sick for a day or two, there's really no evidence that there will be long-term implications. But each of you are going to have to make your own decision, and it is your decision to make. And so I'll be first in line to get a vaccine. I'm going to tell you that right now. But I do appreciate that each of you will have to make your own decision. I want you to make the best decision for yourself, and I hope we get enough people to get the vaccine that we can develop that herd immunity that we're all looking forward to get out of this crisis. Okay, so what have we learned? It just feels like this crisis has been going on forever, and some days, like when we're in this surge, it feels almost hopeless. I don't know about you, sometimes I feel hopeless. But we do know that the public health precautions work. I know that there's been a lot of divisiveness about this and a lot of resistance to the public health precautions, but they do work when you keep distance. You know, when we had the initial stay-at-home order, we didn't, you know, I've heard people say, well, you know, we all stayed home and nothing happened. Well, nothing happened because we stayed home. If you simply do not congregate, if you never come in contact with other people, you'll never get any disease, because how would you get a communicable disease if you don't come in contact with it? But none of us wants to live our lives that way. So that 6-foot separation, that no more than 15 minutes, the wearing the mask, all of those things are layers of protection on. And I've used this analogy before, and I'm going to use it one more time. When you're driving your car, a lot of work has went into making cars safe and safer over time. The location, you know, cars go through massive safety testing, and they've determined the safest place for the gas tank, and they've determined, you know, what tension the brakes should be set at, and we now have blinkers instead of using our hands, and all of these different strategies. We have airbags, seat belts have been developed. No one of those precautions makes sense on its own. It's not going to make as big of a difference, but all of those precautions together begin to layer on safety and exponentially increase the likelihood that if you're in an accident, you won't die or you won't have significant injury. Now, we know people die in accidents every day, and we know people get injured in accidents, but it would be far worse without those safety measures in place. And then we have things like speed limits and traffic lights and stop signs and that type of thing. All of those as well are designed to increase the level of safety. So if we think of these public health precautions that way, no, a mask alone isn't going to save you. But if you keep that distance, if you wash your hands, if you try not to be around people from other households, if you keep the 15-minute rule in terms of working or being in close contact with someone else. All of those layer on the protections that are designed to keep you safe. And so we know that those public health precautions work. A reminder that masks are our last line of defense. You still need to keep your distance and don't gather. And please don't come to work sick. We still have staff who come to work sick. We still have staff who say, oh, well, I didn't feel that well, and I came to work anyways, and then later I got tested and I was positive. Well, we've made so many strides to be able to support telework that, there's very few positions we have at this point that are in person serving our clients directly. And I appreciate that our staff want to support that. But for the most part, you really should be able to do your job from home. And if you can't, you need to trust that we'll figure it out. But don't come to work sick. And if you're in doubt, just stay home. And then if you test positive, we do have a challenge right now with contact tracing. We've had it for some time. When you're trying to stop a virus, the first thing you want to do, and that was done initially, if you catch it early enough and everybody stays home and doesn't mingle in any way, shape, or form, you can stop some viruses. It was too late to stop the virus. It was really that flattening of the curve that we wanted. But the other thing you can do is once someone's positive, if you can identify everyone you may have exposed in that prior 24 to 48 hours, and those people quarantine, you have a better chance of them not spreading the virus. And so one of the things that contact tracers do is they work with the person who's positive to identify who they might have come in contact with, and to contact those people and tell them to stay home. And when we get behind, by the time the contact tracers get to the person who's positive, so much time has passed that you don't get the benefit of that. And so what we're really wanting to encourage you is if you do test positive, you should on your own make every effort to contact people you came in contact with, or contact work if that's where you came in contact, and let us take responsibility for that and have them quarantine as well as you isolate, and anyone in your household quarantine. New CDC guidelines came out this week that are reducing that quarantine period. And remember, quarantine is if you've been exposed. Previously, it's been 14 days, and the CDC is making some recommendations to reduce that. And so those are being reviewed at the state and local level, and you should expect an update to that soon. But that would help us have a little shorter time that you would have to quarantine at home. And our hope is that if that is adopted in Fresno County, that people would be more likely to do it if it was a shorter period of time. That's what we're hoping. All right. And then the other thing is the vaccine's coming, but not for a while. And so, again, we just have to make sure that we recognize that these precautions are going to have to be continued until we get to that herd immunity. And we don't want to have the stay-at-home order last any longer than it needs to. So the sooner we can clamp down on unnecessary mingling and that type of thing where you get exposed, the quicker we're going to get out of this mess. Evidence is beginning to emerge about where and how people are getting exposed or infected with the virus. I often hear people say, oh, I don't understand why I can't go to church when I can go to Costco or I can go to Home Depot. And so there's been a study done on mobility data. And what they did is they looked at, we all often we carry these little cell phones around, and the cell phone has a GPS. And so what some researchers did is they looked at the GPS tracking, not by person. They didn't see where did Dewan Utek go, but they looked at population movement. And so they can use GPS traffic to see, where do people travel to each day? And they've been able to demonstrate, for instance, that when stay-at-home orders were put into place in places like Fresno County, they can tell you precisely how much that reduced mobility, how much less trips people took. And so with that, they can also look at what were the places of interest, they call it, that people visited. How many people went to churches, how many people went to restaurants, how many people went to grocery stores, how many people went to the Home Depot, etc. And they can do it with geomapping down to the store. And out of that, they really have been able to show, and then what they do is they look at that tracking over time, and then they track the COVID positivity rate and see what things correlate with positivity. And based on where people live, those people, in terms of where they traveled to, did they have more or less chance of getting COVID? So they have been able to demonstrate that when you reduce mobility, when you do the stay-at-home orders, not as many people get COVID. Certain types of locations tend to be implicated more. In this particular study, restaurants, places of worship, and even some grocery stores were identified with more COVID. Reducing hours of operation or capacity does reduce spread. I've often heard, what's the difference between 25% capacity and 100% capacity? And they actually have been able to demonstrate that when you do reduce capacity, a really high-risk place becomes not as high of a risk or not a risk at all. And then demographic disparities exist. We think one of the reasons that a lower socioeconomic class has a higher incidence of COVID is many of them are in essential worker positions. And so if you're working at Target, like one of our children does, or you're working at a grocery store, some of those positions are lower paid positions. Some of our agricultural workers, where people tend to work even when they feel sick, or they're exposed to the public more and exposed to COVID more. And so a lot of that that information, evidence is starting to emerge. I anticipate over the coming months we'll get even more information and hopefully be able to provide a little more justification for some of these stay-at-home orders or restrictions at different tier levels. Again, I often hear, it doesn't make sense, it's inequitable, I don't understand why this business is getting punished and that one isn't. And it's really tied to the risks. And so as that research emerges, I'm hoping that it will help inform all of us a little better as to why some of those restrictions occur. And if we can't support it with research, maybe we can lift some of those restrictions. Okay. All right, so county updates. You should expect telework to continue. We reported that last month that it would continue through March, and that hasn't changed, and I don't anticipate it changing. We talked about the new employee check-in, and that check-in, you got an email probably today telling you that that check-in would start, and we've discovered a few little glitches in the system, mostly related to your location. We're required with SB 1159, I think it is, that we have to report which of our employees is at what location on what days. And so that's a piece that we still need to work on so that when you use that app, it can accurately say where you're at. And so I think you got a follow-up email today just kind of alerting you that we're not quite ready yet. We thought we were. Oops. So you can use the Go Fresno to check in and do your health screening, but you'll still need to complete the DBH employee form right now. The new testing is available to county employees and family. I got tested again today, and I saw lots of employees and families out there. That was great. The more testing we do, the better. So it's ongoing. You sign up for a slot via the email link that has come out either from our HR or Maine HR. And then a reminder that we will give you some time off to go get tested with your supervisor's approval. So you don't just leave and not tell your supervisor. You need to work with your supervisor to make sure that your requested time can be accommodated with your work schedule. And if you're symptomatic, please alert your supervisor. We'll work with you to get you, support you getting tested in any way that we can. And I would expect a similar thing when we get the vaccine. All right, I'm going to look at our questions. It looks like, okay, regarding the new restrictions, the ABC 30 website, it says all non-essential travel is temporarily restricted statewide, regardless of which zone you live in. Is that active now, or when a zone is in the restrictions? I'm still learning about the new stay-at-home orders, so I'm guessing that the travel restrictions are going to be in place fairly quickly, and I'm guessing that it's going to be that way mostly because you won't be able to predict how quickly different regions will go into the stay-at-home order. So the statewide travel, I'm guessing, is going to be sooner. But as soon as we know, we'll send that out. And I'm guessing something will come out from Maine HR as well. And then, do you know if the stay-at-home order will affect county court schedules? Here's what I would tell you. I think this stay-at-home order will be different than the prior stay-at-home order. I think it will be more refined, we'll say. So there may still be the ability to do some things that we weren't allowed to do in the prior stay-at-home order, but that remains to be seen. So I expect more information to come out as we understand the stay-at-home order better. Right now, our county is not in the stay-at-home order, but it could happen in the next day or two. So keep your ear to the ground, and we'll get some information out as quickly as possible when we have all of the details about the stay-at-home order. Any questions via text? All right, so stay tuned, stay close to your email so that we can alert you when we have additional information. We'll let you know, that we're going to the stay-at-home order, and we'll give you that detail that some of our individuals' questions play into, which is, can you travel between counties, and how will it impact either courts or something that you're interested in? We'll get that information to you as quickly as possible. So please, please stay safe. Keep your family safe, your loved ones safe. We will get through this surge, but we want to keep it as much in control as we can. It is going to be very, very hard on our healthcare systems to get through this, and we don't want to add to their burden. So please take care of yourself and your family, follow the precautions, and don't come to work or go anywhere else if you're sick or you've been exposed to someone else who's sick. All right, thanks. See you next week.